From the healthcare perspective, I'd like to start by doing a little backdrop
Okay.
of healthcare in Tallahassee and the Big Bend,
Yes,
because
sir.
what little I've been able to do, I've stood on the shoulders of giants that had gone before us, obviously, and
Hmm.
I want to just call their name, as you say, read their name into the legacy, because
Yes, sir.
in 1929 there was a black doctor in Monticello named Dr. Flipper, who was part of the Flipper family. The first West Point graduate from Thomasville, Georgia, was also a Flipper.
Okay.
And that same year, 1929, Dr. William Gunn from Quincy, Florida, started medical practice in Tallahassee. And so the coming out of the slavery and antebellum and Jim Crow era, healthcare in Florida was very, very segregated, and
Hmm.
Tallahassee was no exception.
Right.
And so the giants who were there before we came, the first wave was Dr. Guns, Dr. Campbell, the Dr. Bakers, who's Baker Pharmacy,
Hmm.
Dr. Anderson, and of course, Dr. Brickler.
Hmm.
And in 1911, FAMU, then called FAMC, had a hospital.
Yes.
In 1920 or so, Dr. Campbell had a hospital. And so we had provide services for black people on that side of town. And then in 1950, FAMU had its hospital. And so
Hmm.
the first wave of doctors paved the way for the second wave in around 1970s. And that's when doctors Mac Williams, Dr. Britt, and that crew came to Tallahassee. And
Okay.
then I came in the third wave in 1980s. And
Yes, sir.
so by the time I got there, there was a foundation of doctors that were working in the community and trying to be the difference and provide excellent health care for our people. It's
Okay.
important for the audience to understand also that the AMA, the American Medical Association, which was founded in 1847, would not allow black doctors to join until 1968. Now, what that means is most training programs, residency programs, require you to be a member of the AMA in order to train.
Right.
So very few specialists could be trained prior to 1968 unless they were trained at Howard and Meharry Medical College.
Okay.
So when we entered the 1980s, the third wave of doctors coming in, I'm very fortunate to be among a group of specialists for the first time, where we had more specialists, cardiology, endocrinology, internal medicine, urology, orthopedic surgery. And so the health care landscape was training as relates to black doctors being available. But
Hmm.
we still had the Jim Crow system. Fortunately, when we entered the 1980s, we were still fee for service, and we had not entered yet the managed care era.